Good evening, everyone. I'm Nye Whitaker, and I'm the Chair for Health and Human Services Committee for CB11. Welcome to our February meeting. Marlene, are the ground rules on the agenda for me to read? Great.
No, you could just read the screen if that's, can you see it?
I just have to take my glasses off. Now I can see it. Thank you. So before we get started, I would like to make sure that I share with those who are returning participants, our committee members, and the general public, the ground rules for tonight's meeting. First and foremost, welcome. I know it's a nasty day out, so I know that I'm happy we didn't have to commute today to a meeting and are here on our Zooms in the comfort of our homes or wherever you may be this evening. We ask that this be an inclusive and safe environment. No one is allowed to speak until granted the floor by myself as chair or by Marlene, who is liaison from the district office. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand using the Zoom functions. If you click on the participants icon, the participants panel should appear and allow you to click on the raise hand option. If you have technical difficulties, you may click the chat icon and relay that difficulty to the staff so that Marlene and or I can assist you. Next slide. The chat function should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom and waiting until myself or Marlene recognize you and grant you the floor in order to speak. The chat should only be used to alert us of technical difficulties you're having or to state in writing information that you've already communicated verbally. For example, if there is a link to a particular site or a flyer for an event, information such as your name, your title, your organization, your email address, and phone number. Again, that information must be shared out loud for the record before it is added to the chat. Please keep your questions and comments succinct and germane to the discussion. Members of the public, if you have a question or comment about a particular agenda item or topic or subject, please raise your hand using the Zoom function and wait to be recognized by myself and or Marlene. With that being said, it seems we have quorum, so I'm going to call the meeting to order. This is the February meeting of the Health and Human Services Committee of CB11M, and it is 6:05 p.m. Marlene, can I ask you to please commence with the roll call?
Sure. Eva Chan.
Present.
Oh, Sandy Garcia.
Present.
Robin Krinsky. Patricia Martin. Jennifer Meyer.
Present.
Shirley Pena. Arturo Perez.
Present.
Isaac Scott. Pastor Isaac Scott. Robin Strachan.
Present.
And Nye Whitaker.
Present.
So you have quorum. Nice.
Great, thank you. So we're going to drop the agenda by consent. The agenda was posted on the CB11M website as well as shared with the public, excuse me, and the members of the committee. If there are no objections, we are going to approve the agenda. So I will give a moment for committee members. If you are objecting to the agenda in any way or have a comment, please raise your hand at this time. Seeing none, we are going to go forward and approve the adoption of the agenda for tonight's meeting. In addition, the January minutes were distributed in advance and are available via the CB11M website. We are going to use a similar process. If anyone objects or has any revisions or comments or changes to the January minutes from the committee, I ask that you please raise your hand using the Zoom functions and wait to be recognized. Seeing there are none, the minutes from the January meeting are adopted, and we will move forward with the meeting. Next slide, please. Great. So this is the time that we usually use for announcements, and we always start with information related to COVID to keep the community informed. The federal government is making available vis-a-vis USPS, so United States Postal Service, so it does take a bit of time, free COVID tests. There is a website that is available, which is listed on as a link on the agenda on the CB11M website. We can also drop the link into the chat. And for those who may not have Wi-Fi or internet access, the phone number to call is 800-232-0233. You will receive up to 4 at-home self-test, and they take 1 to 2 weeks. I ordered mine the first day and have already received mine. And so I want to make sure that people know that that's available. Also, there are a variety of New York City Health and Hospital sites and local hospitals where you can also get a take-home test from as well. We're going to move forward with another announcement, which is from our friends at Stanley Isaacs. I believe Lorraine Valentine, my former colleague, is here. Lorraine, are you available to unmute and give us an update about this amazing internship program you have available through Stanley Isaacs for our young people?
Yes, I just unmuted. Are you able to hear me?
Yes, we are. Thank you.
Great, thank you, everyone. It's been a long time since I've joined these committee meetings. Happy to be here with a new hat. I am now the Director for Career Development and Advancement at the Stanley Isaacs Center, specifically at our Education and Youth Workforce Development. I am the Director for Career Development and Advancement in Healthcare and Human Services, training future healthcare workers. Excited to be here. I have quite a few flyers that I'll be sharing with the committee so that it could be shared amongst your entire constituency. Specifically letting folks know that under the Consortium for Worker Education, we are looking to train healthcare workers between the ages of 18 to 24 years old. I do a 2-week career readiness program at the Stanley Isaacs Center, where we also get these young folks free certifications. We provide transportation, also meals to eliminate exposure to COVID. We also do stipends, but they will have to complete the 2-week career training with us in order to receive that financial incentive. As you know, or perhaps you don't, we do wraparound services at Stanley Isaacs to assist young folks with any barriers or challenges they may have. After our 2-week career readiness program, we help our young folks with internships. I've just had a conversation and we're in negotiations with Metropolitan Hospital. We've also just locked in some internships with Maimonides Hospital. We have partnerships with LabQ, Dr. Karen Thornton, who has been servicing Harlem community members as well. And so honestly, we are excited to work and really put our best foot forward to combat any gun violence initiatives and put jobs and give young people some jobs. In addition to that, just so folks know, I will also be sending some information on our senior services that are also available to all of your constituents. We have a free meal program. We have this incredible program that we've partnered up with Metropolitan Hospital called Synergy. And we also have our Cornell students walk-in where members can come and join for blood pressure screenings or general medical screenings, nursing questions. We have nursing hours. And with Synergy, if folks do not feel comfortable going into Metropolitan Hospital, we have a hub at the Stanley Isaac Center, where seniors could come and use our WebEx. We have computers for them. They can do appointments at our facility and site safely. So we just wanted to make sure that we put our best foot forward and we re-engage our relationship with CB11, especially now both seniors and youth could probably use as much access to resources as possible. So we really appreciate this opportunity to join your community board meeting, and thank you for allowing me to make this announcement. But you know, this won't be a one-stop shop for me or Stanley Isaac Center. We're truly committed to our community overall and helping any folks who are disenfranchised or isolated. Thank you so much, CB11.
Thank you, Lorraine. If you could please drop your contact information to the chat, and any links for the flyers, you're welcome to drop into the chat or to email to Marlene so that we can make sure this is available to all. Thank you so much. I'm going to move forward on the rest of the presentations. If there are any questions, you're welcome to drop it in the chat. Right now, we have our usual standing COVID informational updates. I believe that Noelle Alisea from Metropolitan is unable to join us tonight. I do believe that Brad is here from Mount Sinai. Brad, if you have a moment, would you like to give us any updates?
Yeah, absolutely. Hello, everybody, and good evening. Hope everybody's doing well, staying halfway warm and dry tonight. A couple of updates, and obviously happy to take any of this offline if people have further questions. But regarding COVID, number one, obviously, we still aggressively are trying to work with and vaccinate the community. We actually do have at Mount Sinai a vaccination, what we call pod. I'm going to use the word maybe clinic at 1440 Madison Avenue. It is open Monday through Friday from 8:30 to 4:30. And with regard to pediatrics, specifically on Tuesday and Thursday afternoons is when they try to do most of the pediatric vaccinations. So we encourage, implore everybody to get vaccinated as well as boosted, but our site is still open for that. Number two, COVID testing. We also are doing COVID testing. That actually is open 7 days a week from 8:30 to 4:30. And for that also was located at 1440 Madison Avenue. Big picture, I always like to share this data. You know, I think the good news is that the number of hospitalized with COVID has started to decrease. The number we have on site actually currently hospitalized has been cut in about half from where it was just a couple of weeks ago. So that is an encouraging sign. But as a health system, we've actually now cared for more than 15,000 COVID patients. We have actually provided vaccination, more than 350,000, administered more than 350,000 doses of vaccine. The COVID testing itself, we have actually run more than, believe it or not, 1 million COVID tests to date. And we're actually partnering with a couple of key organizations. One is Test and Trace, which is part of H&H. And partnering with them, we have actually conducted testing at more than 1,200 community events, many of them obviously in East Harlem, but certainly not all of them. And we're also partnering with the MTA, and we're testing all MTA employees who are not vaccinated. So I think that's the real high-level overview. I'm happy to take questions or take anything offline.
Thank you so much, Brad. In an effort to stay on schedule, because we have some very large presentations, I'm going to go ahead and move forward.
Okay.
If there are any questions regarding our COVID updates, I ask people to enter them into the chat. From the public, are there any questions from the committee members? Okay. We're going to go ahead and move forward. I believe that we have a series of presentations this evening. I ask everyone to please bear with us on time. These presentations are very important. I will do my best to try to keep us on schedule. And so I ask everyone, if you do have a question going forward as we listen to these presentations, to please be brief. So the first up, I believe, Marlene, is the Fortune Society presentation about the Castle 3 project. Are the speakers from Fortune Society here?
Yes.
Great. So I want to welcome the staff from the Fortune Society, which has been a long-term provider in our community. Sherry, are you going to kick it off or who will start?
Stanley's going to start. Stanley.
Okay.
Do we have this?
Stanley, I'm so
Hey.
excited that you're back. How
Thank
are
you
you?
so much. I am
I
doing
know
so well.
You
So
left
excited to be
briefly,
back.
so I'm happy to have you return. And I know you've presented for us in the past, but I know that was a while ago during the pandemic. So I'm happy to have you here to present to our committee. So
Thank you.
the floor
Thank
is
you
yours.
so much. Do
So
we have
we
the
need
slides?
The screen sharing privileges. Esther needs to be able to share her screen.
Yes.
Great. Marlene, can you please give Esther access?
I'm taking my screen down so all panelists have access to share their screens.
Great.
Okay.
Esther, I see your hand raised. So if you could just let us know when you have access.
She has
You're
access
welcome.
right now.
Great. You're welcome to unmute.
Are you good, Esther?
She said, unfortunately, she still doesn't have access.
Well, let me, while they work out that technical, let me just start by sharing a little bit about the project that we are proposing. The project we're proposing is a project that's located on 107-11 East 123rd Street. It is permanent housing, a combination of supportive housing for people who are homeless and have criminal justice involvement, and units, low income, affordable units for the community, with a specific target for Community Board 11. When we first came and presented the project, we talked to the community board, and what we heard was that the community board wanted housing that was truly affordable. And I'll go through sort of the income and the levels. We really targeted this to make it affordable for people, low income. This is a project that is partnered with Curtis Ginsburg as our architects, Amy LeBaire, Esther is from Amy LeBaire Consultant, and the Fortune Society and HPD. We got this land through competitive competition through HPD's lottery program. And so we were afforded this opportunity and we're really, really excited about it. As I said, it's around quality, affordable housing. There's 82 units for New Yorkers earning up to 60% AMI and serving extremely and very low residents and their families. 58 of the units will be reserved for homeless, formerly incarcerated individuals. 24 of the units, including one for the Living Super, will be for affordable. We're going to have on-site comprehensive supportive services, including counseling, workforce development, education, and a host of other services. The Fortune's mission really is to support successful reentry from incarceration and promote alternatives to incarceration. We know by doing that, it really strengthens the fabric of the community. We are committed to making sure that our communities are safe and people have a way of building back post-incarceration. Fortune Society serves over 9,000 people a year. We have a range of services at our main service center in Long Island City, where there's multiple points of entry, lifetime aftercare, and we've been around for 54 years. In this particular building, we're going to have 24-hour live security, front door coverage. We're going to have a multi-purpose room that will be available to the community to use, like we have in West Harlem, where Community Board 9 regularly meets in our space. We'll have supportive services, as I said, on-site case management, trauma-informed assessment and services, crisis intervention, coordinated access to legal services, life skills training, education and employment. We're building out an industrial kitchen to be able to do culinary arts training. So we're building out a lot of services to provide both to residents, but to the broader community. We want to be an asset to this community. A number of years before COVID hit, a couple of our leaders and Councilwoman Ayala walked around that particular area. We went to a park where there were homeless people sleeping in the parks. We seen hypodermic needles on the floor, and we engaged them and said to Councilwoman Ayala, we want to be a resource. So if anybody needs help, we want to be able to do that. And so this building is going to be just that. There's going to be a front yard, a rear yard. There's going to be exercise space, gardening beds, a walkable skylight. As I said, a teaching kitchen, really building out services so that the folks who are formerly incarcerated have huge resources. A little bit about the unit breakdown. 58 of the units are going to be studios, 30% of AMI, maximum household income of $42,000. We're going to have 2 studios at 30% AMI, and that's monthly rent of $483. We're going to have 1 1-bedroom and 1 2-bedroom at 40% AMI, and these are all of the affordables. And a studio. The studio will be $662. The 1-bedroom would be $828, and a 2-bedroom would be $993. At 50% AMI, we're going to have 5 studios, 2 1-bedrooms, and 1 2-bedroom. Rent at $841. The 2-bedroom is, the 1-bedroom is going to be $1,000, and the 2-bedroom will be $1,200. And then 60% AMI, we're going to have 4 studios, 5 1-bedrooms, 2 2-bedrooms, and 1 bedroom for the super. And those rents will be $1,020, $1,200, and $1,500. And so we're really making it affordable. It's going to be a beautiful building. Curtis and Ginsberg has been architects that work with us on Castle Gardens, which is supportive and affordable permanent housing on West Harlem. They do a beautiful designs. It's going to be an energy efficient building, really adding to the community and adding to the health of community by having the materials that we're going to be using to be environmentally sound. We're using the passive housing standards. It's going to be an all electric building, except for the backup generator. We're going to have PV solar array panels, heating and cooling using V8 VRF heat pump system. And so it's really going to be environmentally designed. And a couple of principles we're using is 1, active design, acoustic comfort, energy efficient and thermal comfort, making sure that our material is resourced and resiliency, water efficiency, and renewable energy.
Awesome. I want to make sure, Stanley, that you guys stay on time, and I know that there may be some other presenters. So I just want to make sure we kind of focus a little more on the kind of social service health wraparound component, because I know you've covered some of this in our housing presentations. And I know that that's what people are going to want to know about is, how we're going to help all of these amazing people reconnect to the communities and move forward.
Thank you. Yes. I'll end with this. Fortune is an organization that really walks the talk. Over 50% of our staff are people formerly incarcerated. I'm formerly incarcerated. I came to Fortune when I came home from prison in 1991, and Fortune gave me the opportunity to rebuild my life. And I started as a counselor, and today I'm the deputy CEO of the agency, former first deputy commissioner of the New York City Department of Corrections. And so my life, my journey has been because the crime, what I commit, the time I serve is not who I am. And Fortune never seen me in that light. Fortune seen me in all that I can become. And that's what we're going to do. And that's what our services are meant to do, is to really provide people an opportunity to see themselves in a different way. And we hold that image until they can hold it for themselves. And we've seen over the 54 years, amazing transformation. So I look forward to any questions and comments and working with Community Board 11. we really want to be a resource to you.
Nye, you're muted. Nye, you're muted.
Thank you. Sorry, I was just wondering, I'm going to open up questions shortly to the committee members. I was wondering if there was anyone else from the Fortune Society team that had anything else to add to the presentation. No? Okay, great. So committee members, I just want to open up the floor first to you to see if there's any questions or comments. While you're doing that, please remember to raise your hand. We have, if you don't mind, Stanley, if you want to just at least introduce who Joanne and Sherry are, just so that if questions come up, people will know who's answering them and who's here representing the Fortune Society.
Absolutely. Sherry Goldstein is our VP of Agency Operations, and Joanne Page couldn't make it tonight. So Sherry and I are representing the agency.
Perfect, thank you. So Marlene, are you seeing any hands raised from our committee?
Sorry, I was on mute.
It's okay.
That's her hand raised.
Okay, so before I want to make a call, I just want to say I applaud the work that you do. I've been to the Castle Project in partnership with Barry Weinberg, who's the chair of Community Board 9, I believe, and did a walkthrough. And it just is a very magical place, for lack of a better term. And I commend Fortune Society for work, and I thank you, Stanley, for sharing your personal story with us as well.
Thank you.
Eva, if you can unmute yourself, the floor is yours.
Thank you. Well, thanks everyone. So my question is, what is your plan of community engagement? It seems that you have done that in West Harlem. So for example, nearby block associations. How do they get a hold of you? Is there a regular meeting going to be set up? Thank you.
Absolutely. We will be coming. The commitment we made on West Harlem is we go to the local precinct council meetings, we go to the community board meetings, and we will have the same representation for Community Board 11. Community Board 11, the chairs will have my direct cell phone number, my direct landline number, my email. If there are ever any questions or concerns, you'll be able to call me directly, and I will respond. And so we are planning to work with the community board in both when we start recruiting, opening up the units. We want to use the channels of communication that you have to the community to let the community board know that we're open. When we start construction, we want to make sure we're doing local hiring. We have already partnered with Strive. We've been working with Strive for a couple of decades now. We've been working with Exodus. I know the president and CEO personally over at Exodus. So those are both Harlem-based, East Side-based projects. And so we want to make sure that we're hiring locally, and we will stay connected to Community Board 11. That is our commitment.
So in case there are any sort of criminal offenses that are committed by your resident, how would the local community members know about that?
Eva, I'm just going to interrupt for 1 second because I think you added a second question before you were recognized. So I'm just going to add to the chat. Stanley, if it's okay with you, I don't know how you feel about putting your information in the chat. Otherwise, you're welcome to share it with myself and Marlene, and then we can make sure that the members of the committee have that information. And I think that when you're moving forward with the call for apartments and as you're moving forward with the construction, I definitely want to make sure that you're invited back to keep us updated as you move forward, and that we keep the lines of communication open. And should you have any sort of ribbon cutting or open house, I would love to be able to invite the committee members and the public to that as well.
Right.
Absolutely.
And just so everybody realizes, we haven't even started breaking ground yet. We're still going through the URLA process. So we're talking about 2024, the building will probably be opening.
Correct.
Great, thank you for that. Marlene, did you have your hand up?
Yes, I do. I just want to focus on the social services piece.
Me too.
Yes. So Stanley and Sherry, thank you for coming again. I know you guys were here last week. So I have a few questions, just focusing on the social service piece. So I just want to know, with the castle, I know you have the existing castle and the castle gardens, right? And then this is forthcoming with the Castle 3 project. But how are these I know that the tenants have to have some form of social justice involvement, have been incarcerated, but are you receiving these tenants from case managements in existing prisons, existing holding areas? Where are you getting them from? Where is the referral coming from?
Right, they will be coming from the city shelter system. They'll be coming from Fortune programs. 20% of the people who walk through our doors are homeless. And so they will be people that are already engaged in services with us who meet the homeless criteria to be eligible for the building, or we'll be recruiting from the city shelters. The way we like to describe our supportive housing, we say it's a program first and housing second, because we want everyone to understand that we have very high expectations about what they would be doing when they come to our building. That is, that they make a commitment to engage in services and to engage in this kind of supports that can help them build new lives. So we'll be recruiting from Fortune's own population, who 20% is homeless, and from the city shelters.
Okay, thank you so much. So, and the Castle 3 project will be permanent, not transitional. These are permanent housing for formerly incarcerated.
Permanent housing.
And affordable, both. Yes.
Okay. And just my knowledge of supported housing, usually you have to have some type of diagnosis. So are the wraparound services mandatory?
Mm-hmm.
Yes.
Yeah.
They have to engage, like if they've ever misused substances, they must engage.
That's right.
Yes.
And that's going to have a bearing on whether they can actually stay inside the unit.
Well, because it's permanent, so this is where, it's permanent, but they have to engage in services. And this is how we've done Castle Gardens. And if you ever want to just come and take a look at how we operate Castle Gardens, you'll see how this building will operate. What we do is we set up those social supports for people. And we have a special program up in Harlem, is that when people are stable enough and they're ready to move out, they could find another place. They could apply and transition to another place, or they could stay there because it's permanent housing. And we'll continue to provide services. So our model is, when you first come in, we have an intensive engagement model. And as you stabilize, we go from like phase 1 to phase 2, and phase 2 might be less intensive, but still with the kind of supports people need. And then phase 3 is, as they are stabilizing, they've shown some duration of stabilization, we move into just maintenance. And maintenance could be meeting with them once a month, doing a home visit, making sure everything is okay.
And just so you know, they will have a case manager right on site.
Got it. Okay.
And then further support services will be there, but also they'll be eligible for the whole array of services in Long Island City, which is our service center, and it's a very easy commute. We have both from Castle Gardens come there daily.
Okay. All right. Thank you. So I don't have any more questions. I just wanted to know what services are going to be offered to these and where they're coming from.
Thank you, Marlene. I don't see any other hands from committee members up. Marlene, do you?
I don't. Or
Okay.
I don't know if you want to call for the public. I don't see any public hands either.
Okay, I'm going to do a last call. If there are members of the public who would like to ask a question. Again, we want to stay on time. We have another presentation that follows this. Please raise your hand and wait to be called on. Okay. Seeing none, I'm going to say thank you to the team from the Fortune Society. And as I said, I'm so happy that you guys are here and that Stanley's back. And please keep us posted as this project moves forward. You are always welcome to come and give us an update. And if there's anything we can do to help you with local hiring and or getting the word out about those units that are set aside for CB11 members to apply for, the rates look very amazing. And I know that there are many who would benefit from this type of permanent supportive housing and your services. So thank you so much. And we look forward to keeping this conversation going.
Thank
you,
you.
Madam Chair.
Thank you. Thank you. Take care.
Thank
Bye-bye.
you. The next informational presentation we have is from the Harlem Strong Mental Health Program over at the CUNY Graduate School of Public Health and Health Policy. Marlene, are those presenters here?
Yes.
Great. So I'm going to ask you to help me identify. I don't see names on the presentation. I apologize here.
It's okay. Deborah Levine, and I see
Deborah
that she
Levine.
has Victoria.
Great.
Yes,
I just
and
saw the
Dr.
slide come up.
Hunter.
Wonderful.
Yes, and if I could share my screen.
So I feel like our agenda needs to have like a couple of minutes of transition in between the times. So I just want to let everybody know we're allowing for a few minutes of transition since both of these organizations have presentations and we have to allow a little bit of time for tech. Once you're ready, you guys have 15 minutes, however you would like to split that time, and then I will call for an open for questions.
Sure. Thank you very much. Thank you, Madam Chair. Thank you, members. My name is Deborah Levine. I'm the director of the Harlem Health Initiative for the SUNY School of Public Health and Health Policy. I'm going to turn this presentation over to Dr. Malcolm Punter, who is the president and CEO of Harlem Congregations for Community Improvement and one of the main PIs on this project, along with Dr. Victoria No, who is a PI for the School of Public Health and Health Policy. Thank you.
Can you just tell everyone what PI means?
I'm sorry, sorry, I'm losing my voice.
It's okay. Thank you. I appreciate it. Welcome to everyone.
Dr. Punter?
Thank you, Deborah and Victoria, and thank you, Madam Chair and the committee and the community residents of the Community Board 11. I am the President and Chief Executive Officer of the Harlem Congregations for Community Improvement. We are commonly referred to as HCCI, and although we're often known as affordable housing developers, we are participating with the City University of New York School of Public Health and Health Policy under the leadership of Dr. No and Deborah Levine, and providing mental health services to the Harlem community, greater Harlem community, including the eastern portion of Harlem. We'll go over a brief presentation, the background of the community needs, the project which we refer to as the Harlem Strong Initiative. We'll present an overview, and then we'll talk about the next steps. We're already engaged in this particular initiative, which you've heard is sponsored by the City University of New York, but also funded by federal as well as private funding sources. The federal private funding sources extend the project over a 5-year period, and it is intended to be a community-based participatory initiative, which includes several phases that what we refer to as a mixed method study protocol, meaning that we will conduct survey and interviews one-on-one in many cases, and then we also will collect down data and analyze it in a way that will present a clearer picture of the study subject. Our study subject specifically is the increase of anxiety and depression in the Harlem community due to the impact of COVID-19. Next slide. Unfortunately, generally in low to very low income communities that comprise primarily of Latinx and African American low income residents, mental health, we found that mental health has been persistent. But what we found, in addition to during normal periods of time, during the COVID-19 period of the pandemic, we found that mental health needs have increased by 2 to 3 times. More specifically, we found that 2 to 3 times higher death rates in Black and Latino communities, compared to the majority communities. We also found depression and anxiety rates to have increased during this time frame from 30 to 56%. These are what we call disparities, mental health disparities. Next slide. Some of the more specific findings that have been assessed during the data collected period of September in 2021. And I'll highlight some of the larger percentages, but we have an increase or a situation where almost 64% of the people surveyed indicated that they had experienced interpersonal violence. Over 77% of the same population indicate that they are at risk of post-traumatic stress disorder. And PTSD is often associated with, soldiers going to war. So people in our communities, the Latino and African American communities, are saying, by virtue of these surveys and findings, that their lives are tantamount to what happens when someone is experiencing post-traumatic stress. And we find that to be true because anecdotally we know that gun violence is up and domestic violence situations are up. And then when you compare, mental health and other debilitating factors that are psychosocial related, we see the impact. So the Harlem Strong Initiative is designed by the project team to address, these conditions and hopefully provide solutions to them with the help of the community board members, and what we call a community advisory board. Next slide. As mentioned, the funding sources are the federal sources, such as the National Institute of Health, that same agency that we commonly now associated with Dr. Anthony Fauci. Also the Robert Wood Johnson Foundation, which is a private foundation, as well as the City University itself has made a significant contribution to this study. Some of the partners are depicted here, illustrated here, from healthcare companies and hospitals, academic institutions, even local churches, Mount Calvary, St. John the Baptist, the Catholic Church, and city agencies and our elected officials also have signed up. And this partnership figure will grow larger because as the program is being introduced to community boards and the public, many more people are signing on. Next slide. The specific aims of our study is to develop a multi-sectoral coalition-focused community engagement process. Also tap into innovations that could be useful in reducing the siloed and disparate healthcare system, particularly mental health. We're going to hope to do some system transformation, meaning that the Latino folks that have reported that they are disconnected from the mental health care system, we will connect them and reconnect them. And then we also want to have a sustained mental health integration process. The second aim was do some formative work, which is the work that you start to do by identifying key stakeholders and identifying the barriers and also who can become what community organizations or what systems become facilitators to either barriers or to connecting folks to the appropriate healthcare services that they need. We will, as part of the formative work, we'll establish a community implementation plan, a multi-sector community collaborative care model, and also community advisory board that we've begun to establish. Aim number 3 is to implement strategies that will allow the multi-care collaborative care model to be delivered and tested in 2 populations: very low income housing and the primary care community. And then, of course, we will compare those 2 communities. And one of the ways we have been speaking to groups like you is that the education and resources currently in our communities are disconnected. We want to connect them through the multi-sectoral community collaborative care model, and then we will use MCC plus an innovative technological program which will be realized in an e-hub, an e-hub system. And then we think that adding the MCC and the technology will enhance the ability to connect to mental health services for members of our community. Next slide. The Mental Health and Economic Empowerment Collaborative Network. So part of the innovation is adding not only mental health, but also a financial literacy portion to the study. We will increase the capacity of faith-based organizations and community-based organizations to informally deliver mental health referral information to community members, and the neighborhoods that we're focusing on, and it is the Harlem community, but more specifically the zip codes that are depicted here. So we'll have 23 housing sites that HCCI, as a large housing provider in the Harlem community, will allow access to and assistance to our residents, as well as we'll include some of the NYCHA communities, and these will be in 6 zip codes as illustrated. We also have, as mentioned, the primary care sites will focus on 16 federally qualified healthcare centers, and those will be both in Harlem, Upper Manhattan, and in the Bronx, and in the zip codes provided. And then we'll also include mental health sites. And these sites are part of our formative work. We were able to find what are we wanted to answer the question, what are the resources that the Harlem community has today, and that can promote mental health access, or access to mental health care. So we found 33 mental health providers that were readily accessible or known to the community, and those came out of eight zip codes in the greater Harlem area. And then community-based social service sites, we were able to identify 77 CBOs, and finally 101 houses of worship that are either accessible or willing to participate in perhaps in providing referral services for mental health. Next slide. And this is the timeline for the study. As I mentioned, this is a 5-year protocol. The initial protocol is to establish those formative work that we've been doing over the last year, as well as establishing the foundational organizational structure that would allow us to responsibly, with care and concern, perform this work in the Harlem community. Part of that is the Community Health Community Advisory Board, as well as the Community Stakeholder Planning Committee. We'll do some public events like the hackathon and the e-hub development, and then we'll also have the Harlem Strong Toolkit, which we'll publish so that everybody understands exactly what the study is intended to do and the objectives that it will hope to achieve. Year 2, we'll do some more of that work, and by year 5, we should have a manuscript, a toolkit, and information that all the community organizations in Harlem and faith-based institutions will be able to rely on in implementing their own mental health plan, or adopting the plans that the group recommends based on their work. Next slide. Next steps, the multi-stakeholder needs assessment. As we mentioned, we'll continue to recruit community-based organizations and faith-based organizations. We're happy to take referrals from the community board. If there's organizations in East Harlem that you think should be a part of this collaborative, we want to know about it. And we have a method in collecting that data. We're happy to share. We also will do some one-on-one qualitative interviews, and this will provide rich information on a one-on-one basis that we will analyze and do a thematic analysis to get what the community is saying to us. And then we'll do some more quantitative analysis based on the resident surveys, and also the CBO and FBO survey administration and data collection. Next slide. And as I mentioned, this is really about community engagement. We don't want, we know that communities like East Harlem and Central and West Harlem may have been distrustful in the past of academic and research institutions. So the City University, as a public institution, is saying and putting their time and commitment behind it, that we're going to work with community organizations so that we can deliver the services in a way that is sensitive, in a way that is collaborative, in a way that is not harmful to anyone that we interact with. So we're going to do that by having a community stakeholder planning council that will be made up of the organizations and individuals that live in the community, who will then monitor the work that we do and participate in the work that we do. And then also, of course, we love East Harlem, so we're going to engage with East Harlem. And then the Consumer Community Advisory Board, which I will have the honor of chairing, will be made up not only of academics and research scientists, but individuals that live in the community and tenant association representatives, as well as their elected officials.
Awesome. I want to just check in on time, and it looks like we're good. This is, I guess, the last slide here.
Yeah, so thank you on behalf of the project team, our leader, Victoria No, who is the project investigator, and myself and Deborah Levine, who are the co-project investigators on this initiative.
Great. Thank you so much. Of course, I'm going to do a little chair's privilege with a couple of quick things. First, would love to see how we can partner with you to identify some spaces on the CAB for an appointment, whether it's a member of CB11 executive leadership, like our chair, or vice chair, or an appointment. You know, we have some boards where we identify a community member to sit and represent, you know, CB11's residents. And so would love to follow up with you on that. And then secondly, I just would like to make sure, and this can be something that we follow up with offline, that we are reaching out to our ethnic groups on this side of town. So for example, our, you know, Mexican, Puerto Rican churches, our African mosques, et cetera. So just want to make sure, you know, we have such a rich and diverse culture over here in East Harlem. I want to make sure that we have representations across the board from those different constituent groups, so that language access to services can be part of the research. And also, you know, we can really explore some of that misinformation, disinformation, and trust issues that come based on not only just living here, but also other, you know, faith-based and cultural sensitivities, and how they play into how people experience the pandemic and mental illness. So I will definitely follow up with you on that. Are there any, Marlene and or I see our chair, Xavier, is here, and also the committee members. Are there any questions or comments? If you could please raise your hand so that I may recognize you.
I don't see any raised hands, Nye.
All right. I want to thank you guys for that very detailed presentation. I'm very excited about this project. I also just want to recognize Deborah. Deborah has been sharing information with us about our particular zip codes, in addition to the information that we get from New York Health and Hospital and the Test and Trace team, Mount Sinai, Metropolitan, and the East Harlem Health Action Center, and Borican. So I just want to recognize Deborah's support of making sure that we get information out into the community and that we all stay safe. So thank you, Deborah, for all of your help and support.
Thank you, Madam Chair, and we commit to continuing to come back to update you as often as you will allow us to share our updates, and when not, we will provide them to you in reports.
Awesome. I think it'd be great if there was some sort of website where we could see, you know, whether you do a quarterly update or however you do it, that we could then have you come and present, and then, you know, have that update available to those who want to track this project as it develops.
Mm-hmm.
We will definitely. Sorry.
Yeah, I was just going to say, we would definitely be setting up a website. So we just launched, and we will get all of that out and open so that, you know, so that everyone can have access to the information and resources.
Great, thank you. I'm on faculty at NYU, so I know how long it takes to get these things up and running. I also just want to thank HCCI for all of the tremendous work that they do in the Harlem community, river to river, north to south. You know, you guys are just so involved and such an anchor organization. We definitely appreciate you and recognize you.
Thank you, Madam Chair. Thank you so much.
Thank you, Dr. Punter. Okay, I think if I don't see any questions from the committee, are there any questions from the general public before we move on? If so, please raise your hand and wait to be recognized. Marlene, are you seeing any?
There aren't any hands raised from the public.
Thank you, everyone. That concludes the presentation, informational update session of tonight's meeting. And we're going to now move on for the discussion related to the mayor's preliminary budget for fiscal year 23. Marlene, do we get any additional updates as of yet?
No, the office has not received the mayor's response to the preliminary budget. So once the office receives that, it will go back on your agenda for March, and you'll have a 30-day turnaround time as a board to respond back to the mayor's responses for your budget request.
So I just want to make sure that everybody has this on their radar for all of the committee members and also the general public. As soon as we get this information, as Marlene stated, it will be back on the agenda for March. That is that very lengthy, huge Excel chart where we then have to look at the priorities for the budget for our district and engage with our district needs and budget committee and its chair, as well as be able to review with the different agencies where the budget is going, where the priorities are, and make sure that East Harlem and CB11M are at the top of their list. For this process, now that we actually have a vice chair in Arturo Perez, Art will be our liaison to the District Needs and Budget Committee, and will sit on that committee through this process on our behalf to be able to communicate information back and forth. So I want to thank Art for stepping up to assist us with that process. And just know that if this is added to the March meeting, our March meeting will be a lengthy meeting so that we can get through this, and it will probably be the primary focus of that meeting. Are there any questions from the committee members about what we just stated? Okay, we're going to move on then to old business. And I did not put this item in, but in researching with our committee members and our chair and Marlene, who's our district office liaison, March 23rd, our previous resolution calling for a moratorium on the expansion and or siting of new drug treatment facilities would expire. And so I, in chair's privilege, would like to recommend that resolution be added to our agenda for the March meeting, and that we vote to renew for another 12 months. So I wanted to present that to the committee. I don't know if our chair, Xavier, would like to add anything to that. I see his hand is raised. Xavier, the floor is yours.
Thank you. No, I appreciate everyone's patience, just surviving family dinner with two little boys who apparently don't like fish. So we passed this resolution. We were calling for a moratorium. We asked everyone to give us time so that we can actually investigate, do our due diligence before taking a more defined position on the clinics that are here in this community. And as many of you who were lucky enough to be born in the 70s and 80s, still some of the best decades, 70s preferential. This was not, yeah, that's right. It was not a good time for New York City. We had a lot of issues we were facing, and we were sending out cries for help. We did not foresee that this saturation, if you will, would come about. And I think what we care about all of our community members, period. That's without a doubt. I think what we were denied, and I was there, and our chair emeritus, Nilsa Rama, Angel Muscane, when we met with Irene, and there were conversations and presentations done by DOHMH where they said, oh, no decision's been made. We asked more specifically, are we being looked at? They obfuscated in answering. And then subsequently with Angel Muscane, our district manager, had a subsequent conversation where it was stated vehemently that we were not being looked at. Obviously, that was not the truth, because right after Thanksgiving, we had the safe injection site. So again, it's not about the issue of whether or not we have compassion or want to help and save people. We absolutely do. But I think the fact is the community and by extension, due to their unwillingness to engage and be forthright, we were denied that opportunity. And so what I ask of this body, this committee, when we go into March, is to consider those facts and ask, were we afforded the opportunity to have meaningful engagement, not just with the agency, but with the community at large, and were they allowed the opportunity? And I think that's the larger tenet of democracy, is about awareness. I'm pleased to answer any questions. Again, we were a bit incensed because there was not disclosure, and in a truly productive democracy, everyone is having honest dialogue at all times. So that's where it is.
I just want to add two things
yep.
to what our chair just stated. Two other things to keep of note is that there's a new administration. And so when we passed this in March of last year, that was under the de Blasio administration. And I believe that, as we saw, as Xavier said, as like a thief in the night, something was cited in our community without any open dialogue. And so I do think that, I'm in favor and would ask, this committee to consider, this renewal because we now have a different administration and a new opportunity to raise our concerns and to educate this new administration about the fact that East Harlem has been carrying a greater burden and now deserves to have a fair share reallocation and revision to this. Secondly, we've been doing our due diligence, as Xavier mentioned, by inviting many of these programs to come and share their services. We've also have reached out to Oasis to come and share with us. There have been many task force, both at the state level through our assemblyman's office and also through our council member's office. And we have great advocacy groups and organizations like Uptown Grand Central and others that are trying to address quality of life issues across 125th Street. And so I do think for all of those many factors, and that this pandemic has extended far longer than I think people initially thought, that we should consider extending the moratorium for another 12 months. There's no vote to be taken today, as again, this is just my chair's privilege of old business. Our committee has informed me that this would be expiring. And so I would like to recommend we add it to the agenda for March, that the committee votes to renew it. And again, we have conversation about it. And then we would have to then, should it pass, present it to the board for the board to then also vote in its end of March meeting to join us in a full board vote for the renewal of this. I'm going to pass it back to you.
Thank you. Real quick, as in the interest of time, I want to remind people that when we had the presentation from DOHMH, Dr. Cunningham is now the head of Oasis. And so that is the relationship we're walking into. And we did have a response, which was shared with the board, where they did not acknowledge the fact that during that meeting and the walkthrough, that they were having conversations back in September. We would have had an entirely different meeting if it was under consideration. It was also disclosed to those in the meeting that Bronx, which has the highest amount of ODs, was not able to get something online in time before the mayor who exited, de Blasio, and that Staten Island did not want it, where the second highest amount of overdoses. So we were looking at this in a very holistic fashion. And I again, as someone who's had family members who suffered from substance abuse and been through that with them on that journey when they were on this earth, again, I think we're approaching it from a compassionate point of view, but in the same sense about what is the harm that could potentially happen to the next generation. And we ask very plainly, let us do our due diligence and work with us together so we can find a more holistic care for the city at large. So that's it. Thank you. I pass it back to you, Nai. And thank you for the meeting.
I see Eva's hand is raised. Eva, do you have a question related to adding this to the agenda for the March meeting?
No, separate old business.
Okay. So again, there's nothing to vote on here. I just, as chair's privilege, wanted to add that this is a piece of old business that we will be adding to the agenda for March to then call for a vote to have it renewed. Should it pass, it would then have to go to the full board for their March meeting, which is just before the expiration. So the clock is ticking on us. Is there any other old business? I believe Eva's hand was raised. Eva?
Yes, thank you. I appreciate you putting the moratorium back on the agenda and your advocacy. So what I was gonna ask is, I wanna thank Marlene for getting the data from Mount Sinai last time. who promised to give us the percentage of the patients that are undergoing in the methadone center in the Lee building who are from East Harlem. So the outcome was 18%. So 18% of patients treated in the Lee building are from East Harlem. And I want to ask if the community board would permit us to ask an additional follow-up question from Mount Sinai, which is how many percent of their patients come from Central Harlem? Because given the location of Lee building, it is essentially served, on the border of East Harlem and Central Harlem. I think it would be more fair to also assess, whether they're servicing the other side of Harlem. So, the number of 18% seems awfully low, but I just want to be more holistic in terms of, getting numbers from them.
Sure. So, thank you. Thank you, Eva, for raising that. I believe that Brad is still with us from Mount Sinai. In the essence of time, Eva, I will have Marlene follow up. I believe Brad has heard, but if nothing else.
Yep, then we'll get it.
Yep, Brad, we'll follow up with you offline and just have you just expand that to consider all of Harlem and its East Harlem's neighbors. So I appreciate that. Thank you, Eva, for that clarification. Thank you, Marlene, for getting that data. Thank you, Mount Sinai, for providing that update. It's very important to us. Any other old business before we move forward? Because we do have one more item that we're going to have to vote on. Okay. So I'm going to move us to new business. Everyone remembers that last month we had a very moving story by a nurse from Mount Sinai in coordination with the New York State Nurses Association, who was expressing concern about the safety, staffing issues, dignity, and respect of the nurses at Mount Sinai Hospital. They presented us with a resolution and we're asking for a letter of support. So because of timing, we had to invite them back this month. And so I'm going to call on, I believe it's Jeremy and Anne to present. Marlene, can you assist us in making sure that those speakers are here and if they need access to sharing for their screen?
Well, Jeremy sent an email, said he wouldn't be here, but his are here and they're all panelists, so they have the ability to unmute themselves.
So can you just, I don't want everybody speaking at once, but could
Anne
you?
has unmuted herself.
Great. I just want to know the order of speakers so that I can recognize them accordingly.
Right, so Anne will be first.
Hi, good evening, everyone. Our speakers for tonight, hi, thank you for having the New York State Nurses Association. I'll call on Ms. Natalie Hernandez to post at least the screen share our presentation, and the order in which the people will be speaking will be Keisha Carrington first, local bargaining unit president at Mount Sinai Hospital. Shelly Ann Logan, she's one of our nurses too, and Ms. Gail will also be speaking to wrap it up.
And then Marlene, can you just remind me, since this is in new business, how much time they have for this presentation?
On mute. They should have 10 minutes.
Great. Okay.
Right.
So let's get the screen up.
If you would like to extend that since they're the last item, that's on you, Nye. If you would like.
I first want, yeah, let's get the screen up. I'm going to go ahead with the 10-minute mark because it is getting late on a Monday night. And so I'm going to start the time once your screen is up and you let me know that you're ready so that you don't lose any time. And I thank you for joining us and bringing this to our attention. Okay.
Okay, good evening, everyone. Thank you. My name is Keisha Carrington. As Ann said, I am the president of our local LBU executive committee. And I am so grateful that you have provided us with this platform to speak on a really, really important topic, and that's safe staffing in our hospitals. Mount Sinai provides care to members of CB11 and its surrounding community. And we have had staffing issues prior to COVID, and COVID has just exacerbated a lot of the pre-existing conditions that we had in the hospital. Hospital administration is refusing to follow our staffing grids, and they have set us up for failure. Our nurses are leaving in droves because they're finding travel positions, they're finding per diem positions, and they're gone in like excess of 300 nurses. This is directly affecting our nursing care. It's affecting the community. It's affecting our nurses. We feel disrespected. We do not feel valued. We feel demoralized. And each time we ask for them to sit at the table with us, we're met with resistance. And my colleagues are going to speak about some of the issues that they face on a daily basis working at Mount Sinai. Can we go to the next slide, please? Okay. We've been trying for months and months, and they're failing to recognize how their inactions have led us to where we are right now. So we are imploring this community board, as well as their neighbors, all your friends, because we will all be patients one day, all of us. So Shelley, can you share with us what you'd like to share with the board?
Yeah, sure. Thanks. Good night, everyone. Good night, Madam Chairman. I am Shelley Ann Logan. I have been a nurse for over 9 years. Although the conditions have been bad in recent years, I've never seen a widespread level of demoralization amongst our nurses, even approaching what you see now all over the hospital. It's everywhere. We became nurses because we care, because we want to provide excellent and compassionate care for all our patients. We're trained to take care of the old patient, not just the disease. We're trained to be proactive, to be advocates for a patient, to catch other mistakes before they happen. We're ready to roll up our sleeves at any given time. We're being spread so thin. Most of us are leaving in droves, that was pointed out before. We often can't possibly provide even the bare minimum adequate care for all our patients. It's hard to describe just how distressing it is, from a day-to-day basis. Personally, I can, testify to that because last 2 years being a cardiac nurse, I myself, after doing my first mammogram was, got the most terrifying news that anyone could get, being diagnosed, with some form of cancer. And the support that I got, even from my manager, I got a fight, even getting days off to get, screening. And that was a screening I was putting off because I was, doing my duties. And, this is a testimony that many nurses can themselves make. And I mean, I didn't even get a phone call from my manager to see how I was doing. She only wanted to find out when I was going to be back. And the letter clearly stated where I was doing the surgery. It clearly stated what the surgery was being done for. So, I mean, I felt abandoned. And these are, my story is just one out of many stories that many of the nurses, they're going on FMLA because the level of mental illness amongst us, we talk amongst ourselves daily, and even just asking for retention pay because many of our travel nurses are getting what we earn in a month, they're getting paid that in a week. So, there's no motivation, and the resistance that we're getting from management each week, they offer us cookies and cake as incentives, I mean, that's, highly disrespectful. So we're, appealing for this committee to, assist us in getting through to them, because I don't know, it's going to get to a point where patients are not going to get the care where they want. And it's not because we don't want to provide that care is because physically and mentally we're not going to be able to do that. So that's basically my input and story. I'll pass it on to my next colleague.
Thank you, Ms.
Hi.
Shelley-Ann. I'm going to call on Ms. Gail Rivera. Go ahead, my dear.
Hi, my name is Gail Rivera. I'm a midwife at Mount Sinai Hospital. I've been a midwife for 30 years. I'm very thankful to speak before this committee because East Harlem is very dear to my heart. I grew up in the NYCHA George Washington projects right in front of Metropolitan. I want to start with just two basic facts to kind of set the stage for what I want to speak about. Black women, pregnant women in this country are 3 times more likely to die from a pregnancy-related cause than white women. These are not made-up statistics. They are facts from the CDC. The reasons for this are hemorrhage, hypertension, preeclampsia, blood clots, etc. These disparities between Black and white women exist even for a highly educated woman. So a Black woman with a college education stands the same risk of losing her life due to a pregnancy-related issue 3 times more often than a white woman. In terms of newborn babies, neonates, as we refer to them, African-American babies die at rates 2.3 times that of white women. What are the causes? Low birth weight, sometimes congenital malformation, sudden infant death syndrome, and accidents. I mention these because a great part of the work that I do is with women in the clinic at Mount Sinai and in labor and delivery. So how does the nursing shortage impact the clinic? Well, having less nurses means there's less nurses to do the education that we need to do, the childbirth education, the education about newborn needs, about sudden infant death syndrome, et cetera, the education and the counseling that's needed to counsel our women to get COVID vaccinated, which, as you know, Black and Latina women have lesser rates of vaccination. And in pregnant women, if they get sick with COVID, they can get very seriously ill. So in the clinic, another way the lack of nurses has impacted us is that we can't get women in to their initial prenatal visits, sometimes for a month or 2 months. And anybody that's been pregnant or known someone pregnant, we want people to get into prenatal care as soon as possible so we can address some of the issues that may come up. In terms of labor and delivery, the nursing shortage and the fact that we're bringing in young nurses leaves us very vulnerable. There's a saying in Spanish, the devil knows more because he's old than because he's the devil, meaning experience is what's needed. We run a very high risk labor and delivery, and having new nurses, they're just not equipped to deal with the signs and symptoms that are presented early on if someone is having problems. And it takes a couple of years before people can reach the stage of expertise where they can pick up these signals. It's not automatic. So what does this lead to? What we're asking for is that this community board support us as much as they can, pass the resolution that was presented to you, asking that Mount Sinai present itself to this committee and answer questions related to their plans, both short and long term, for dealing with the nursing crisis. And also to share the resolution, if passed, to other community boards and organizations that serve this area. I don't know if people watch 60 Minutes, there was a whole segment on the nursing crisis that the nation is faced. And so we need bold action, we need short-term action, and we need long-term action. Thank you for hearing us.
Thank you. I really appreciate it. I didn't want to interrupt anyone because I know this is so important. And so I just want to do a time check. Are there any other presenters before we move forward?
That is it, Ms. Chair.
But I
Okay.
did want to just add that we have added the link to the letter that we're asking the community board to sign on to. The link to the letter is in the chat.
Okay. So thank you so much all for your presentations. Thank you for sharing your personal stories. And I just want to say on behalf of our community board and the residents of East Harlem, that we thank you for your service and for your sacrifice. It does not go unrecognized. And so I'm going to just call on Marlene. Marlene, would we have a way to pull up the resolution? This resolution was written by the New York State Nurses Association and shared with us. It was shared out previously as part of the links on the community board website and the emails that went out. But on the screen, just so that everyone who is here today can review it. Is that possible, Marlene? Okay. So there was a draft resolution that was shared by the Nurses Association. And before we get to the document, I want to just remind us of two things. First, this is a national nurses shortage. We are being informed that this, some of this existed prior to the pandemic, but we do know that the pandemic has caused an increased crisis. Secondly, it looks like Brad is still here from Mount Sinai. And if Brad is available and has any information, I would like to call on you, Brad, if there's any sort of update that you might have or any information you might be able to share with us regarding this situation at Mount Sinai. Any
comments? We're thanking the greater staff. Mount Sinai would not be the institution it is without our nursing staff. And, we realize that and we applaud you for the great job that you're doing. Two, we're more than happy to come back. I'm gonna make a few comments, but this is not my total area of expertise. So if you wish, us to bring others back at your next meeting, I'm more than happy to do that. But really want to highlight, I think, and some very general comments, two key things. Number one, really, what is the issue? What is the challenge that we're facing? And two, what is Mount Sinai doing to address some of these issues? And, I think, several have alluded to the fact that this really is a national problem. This is not unique to Mount Sinai Hospital. It's not unique to, any specific hospital in New York City. It's a challenge really that we all face. Clearly, it has been exacerbated by COVID. I think it's further exacerbated at this point that we do have a number of nurses that are getting opportunities to go to the so-called temporary agencies. Many are leaving for that. Big picture, we're doing everything we can to hire as quickly as we can. Last year in 2021, we hired, again, as a health system, over 1,000 nurses. And in the last 5 years, we've hired 4,500 nurses. So this is obviously something we're aggressively attempting to do. Two other challenges that are really COVID related that we've had to grapple with in recent weeks in particular, with the most recent surge. Many of our staff actually were home due to isolation. They've been exposed to the virus. They were home ill with exposure. Many days we had over 500 staff that were actually on home isolation. Fortunately, that number has now started to come down. The other issue, and something we've supported, but has been the state imposed vaccine mandate for healthcare employees. Again, something we support, but we did lose a significant number of nurses because of that. But trying to be a little more specific, and again, I know I don't have a lot of time. Some of the things that we're doing to tackle this issue, and again, some of these sound like baby steps, but at the same time, the idea is collectively, we begin to make real inroads. On recruiting, we're actually offering sign-on bonuses to nurses as well as referring nurses in hard-to-fill positions. Number two, we are partnering with 1199. We're partnering with NISNA, trying to get good nursing referrals. Number three, we actually now have a nursing school, which actually recently moved to East Harlem up at 126th Street. Many of you may be familiar with that. But those graduates are coming directly into our pipeline and filling positions. This year, we're going to be hiring through that program over 70 nurses. We actually have a nursing internship program where we're taking nurses, getting interns from all over, bringing them in their junior year. And, if they're doing well, we sign them on prior to graduation. So we're doing this through our internships. We're working with nearly 15 nursing recruiting agencies to help fill these slots. We've actually most recently opened up an international recruiting program, something that we have not done for several years, but recruiting international nurses to try to fill these slots, as well as, been alluded to, utilizing temporary agencies. So this is a very complex problem, but something we're working toward addressing. And again, if you want us to come back next month, we're more than happy to do that and to even go into more granular detail. But we are 100% committed to filling these positions as quickly as possible. But the issue is it's a national problem, and there really is a lack of nurses available.
Thank you, Brad, for doing that. I know I'm kind of calling on you a little bit out of term, so I appreciate you sharing that information. I do have just a follow-up question, which is, what more can be done for the nursing staff that is currently there? All of these things sound amazing. They sound like you're creating a great pipeline for the future. My mother worked there for 50 years in the emergency room. And so I know what that experience is like. And I do know, as someone, as you know, that's worked in healthcare with the test and trace team, what the emotional toll has been working through the pandemic as a servant, to those in need. And so you may not have the answer, but I think that is also needs to be part of the conversation, which is, if we have enough money to pay, outside per diems, can we do something to increase the pay for these people? What kind of, leave or time off can we do to increase? Because I know a lot of them are just, darn tired. And now that I know that we have people cycling off who are getting COVID, or may, because of faith or other reasons, may not be getting vaccinated, I know that cuts into, staffing, et cetera. But I think that there also needs to be a plan for how we retain respectfully and recognize and appreciate financially and or through other means, and incentivize those to retain and stay, especially those, as Ms. Rivera said, who have, that institutional knowledge and expertise in some, specific ways. So I think that is something that would be very helpful for us to know for the future, Brad, if you want to follow back up off, with us with that information. But what more can be done for those who are already in, on staff as nurses there, and what can we do to preserve, that current staff, so that we don't lose that knowledge and that service base. Additionally, I just had a question. I think we probably need to invite them in, but I live right around the corner from Helene Fould, which is the School of Nursing. And I don't hear a lot about their connection. And so I don't want to misspeak. I said, we probably need to invite them, but I didn't know if there's a connection with them here with Sinai, or, if they're being tapped in any way to provide any additional support staff.
I would have to check on that specifically. I believe we have an internship program with some of the nurses, but we need to verify that one.
Thank you. No. Yeah, I just wanted to double check, because like I said, I just live around the corner. So if you could get back to us on those two things, because what I'm hearing is it seems like there's a good plan for pipeline for the future, but from the personal stories that we've heard, it seems like for the current staff, there needs to be more in terms of dignity, especially this woman sharing her story about time off, given the news that she, had, which was devastating. We need to make sure that this community, which is already underserviced, has the right ratios and the right staff. Because we care about our community and we care about those who serve our community. So I thank you, Brad. I thank you, everyone who spoke. I just want to ask if there are any members of the Health and Human Services Committee who have any questions. If you could please raise your hand. Okay. Are there any members of the public who have a question? If you could please raise your hand. Okay. So, I need to make sure we clarify two things for the members of the Health and Human Services Committee. The information that was shared previously with the agenda has been tweaked coming from the New York State Nurses Association. So the resolution that you have on the screen may appear slightly different from the one that was emailed to you previously. And so I ask that you just take a quick moment to review it. In addition, Marlene from the district office, if we were to approve this resolution, it would then be followed with a letter of support. And so Marlene, I just want to make sure I'm good on protocol. Also, Xavier, if he's still here. Do we now put it up for a vote, or now are we voting on the resolution, or are we voting on the letter of support? I just want to make sure I'm clear, since things have changed a little bit since the initial communication. So Marlene, I'll ask you first, and then I'll go to Xavier.
Right. So just going back on what you said earlier, this resolution has not changed. So it's the resolution from, this nursing staff from Mount Sinai, with the help from the Nurses Association. None of this language has changed. So if you guys have questions that you want to ask, since this was previously emailed to you, you could do that now on the floor.
Okay.
And these changes will have to happen right now, so they can go to the full board for vote on the 22nd. In regards to the letter, so the nurses from Mount Sinai and the Nursing Association is clear. The letter that you want the committee to vote on tonight in support of your resolution has been tweaked. Why? Because the language is not really, it's not really synonymous with what Community Board 11 would say. And that has been emailed to the board. Just to be frank, the letter was pretty biased. And so that language had to be tweaked in fairness to the board. Even though they're writing a letter in support of your decision to write this resolution, it still has to have a clean sound, if that makes sense. And I'll be happy to email the letter to Jeremy. This committee has received that letter, just so it's clear that I don't know if it was you, Ann, that you said that someone put the link of the letter in the chat. That is not what the committee is voting on.
Yes.
Okay.
So
that's
let
clear.
me just clarify a couple of procedures, and I'm going to call on Xavier. This resolution was not written by us. It was written by the New York State Nurses Association in support of the nurses at Mount Sinai. And so when it was originally drafted and shared, it included some very specific language that association and their representatives, are sharing based on their position regarding this situation. It would differ from when we write our resolutions in terms of wording, what we include, et cetera. And so I just kind of wanted to take that one more step. And so I'm going to now call on Xavier, our chair.
Hi, Nye. So real quick, we can offer a letter of support if this committee so chooses. However, with resolutions that have been presented to us and we haven't had enough time to debate the matter and fully vet all the issues and tweak the language so it isn't, whether it is or is not in support, we typically will be taking it up under the business of the approximate month. This committee can choose to take on a language that is more in line with the board's previous positions and precedents. And I apologize for my little ones who are debating in the background, because they obviously care about nursing, as my grandmother was on one side. So guys, so that's one thing. However, giving a letter of support on the basic items called out is a possibility as well. But when it comes to resolution, we have had the precedents for the past couple of years of citations and noting out everything and vetting it in due process. So those are your two options, or you wait till next month. So that's really what again, I'm not going to weigh in on one way or another. Love our frontline workers. We know my dad is a retired physician, grandmother on one side was a nurse, so I get it. And I'm very empathetic. However, the committee has to come to its own conclusion for discussion at full board.
So I would like to make a recommendation to the committee for consideration, I would like to recommend that we simply write a letter of support to the tenants of it. I am in agreement with Xavier that there is language, there's stats, there's statements, there's other things that don't really meet because of lack of citations. Our normal protocol, and it wasn't written by us, and I don't want to deviate from our protocol. But I do believe that there have been some items presented through personal stories and data, so that the tenets and the essence of what the message is something that I think we can support the need for Mount Sinai to look into how they can create the better pipeline, which it seems Brad has shared there's a plan for, and he has offered to come back with additional data. But more importantly, what is the plan to support those that are currently employed and to make sure that they are working in a dignified way that does not put their safety or the safety of the people that they are serving in harm's way. And so, Marlene, is there the draft of the letter that we can share tonight, or is there a vote first on the letter and then the letter shared afterwards?
So the letter that I previously emailed to the committee, is that what you're asking me?
Yes. So there is a draft.
I'll pull it up, no problem.
Yeah. There is a draft of the letter that I've seen that the district office staff has created. It was shared with the committee members. I would like, if possible, for us to review it very briefly on the screen and then call for a vote on this draft letter of support. It would then go to full board for the end of the month for review and an additional vote. So everyone, this is the draft letter of support. And I just have a few minor things. We would, of course, add the date to it. And I would like to recommend, and I know if everyone will just bear with us, I know the time, a few edits. In the I was going to suggest we should say notification of, because we've not witnessed it. We've not been there to do any sort of review, assessment, or survey. We've been notified.
Guys, can you just call out the paragraph? I'll just do it on the floor now. Where are you?
In the section, notification of unsafe nurse. Right. So that was the only thing I was adding, is that we have not witnessed it ourselves. We've been notified that there is this issue. And so there's my recommendation to clarify that. And then the only other item was just the source of the data. So when we currently, Mount Sinai Hospital employs 150 nurses, nurse practitioners, that line, we should have some sort of citation or wherever source for what that information and data is. And then the only other item that I thought we should have is some sort of deadline or time frame. So if we are requesting that Mount Sinai be in communication with NISNA or us regarding the situation, whether we're asking it for the March meeting or whatever time frame we as a committee deems reasonable, 30 days, et cetera. Because we have to allow time for them to receive this and then respond to it. So Marlene, when we've done other letters of support or other things, and Xavier as well, where we've asked for information, is there a standard practice of time frame for any sort of
letters have not had a standard practice of time frame, no. But if you would like to add it, I'll add it now. You just let me know where you would like to add it.
Yeah, I would like to request that Mount Sinai support but also where we say that that they would be in communication with us, that we should say within 30 days. Return to provide updates to our Human Services Committee within the next 30 days. So after the word committee. Thank you. Within the next 30 days. Thank you. So I now would like to open this up to the committee members. If you could please raise your hands if you have any questions or comments, particularly because we are making some revisions on the floor. Again, we should review this, we should vote on this, and then, of course, it would go to full board should it pass. So are there any questions or comments from the committee members? I'm going to take a chair's privilege. Is Art on the line?
Yes.
All right. All right. I know that you're over at Borinquen. I just wanted to double check how the nursing situation is there, if you were comfortable sharing in terms of
Yeah, sure.
capacity and staffing. Thank you.
Yeah, well, you know, like they mentioned, it's a national problem. Certainly means it's a problem at Borinquen as well. I mean, we've had a lot of problems recruiting nurses, and it's no surprise, you know, the issues that are being brought up by Mount Sinai. It's a constant problem for us to recruit and retain nurses, and frankly, we lose many of our nurses that are community-based to hospitals, including Mount Sinai. But I can certainly, you know, understand the situation that they're in. I mean, and we've also, you know, we also get nurses from hospitals because they've been burnt out, and not just Mount Sinai, obviously, but all throughout the city. I mean, our nurses at Borinquen, I think, get very good benefits and our salaries are competitive, but there's no way that we could compete with the major hospitals. The only other benefit that we have is that there isn't that pressure that there is on nurses in a hospital setting with community care. It's not a relaxed setting, but it's a lot more manageable. I don't know what else I can say, but I certainly, you know, sympathize with the issues that the nurses at Mount Sinai are going through. I mean, they are really the front line in many hospitals and many healthcare settings, and they should really be taken care of, and they should be treated with the respect and dignity that they deserve.
Okay. Thank you so much, Art. I just, you know, since we had another healthcare provider on, I just wanted to get, you know, your perspective. So I thank you for that. And again, you know, we're not signaling out Mount Sinai in any way. You know, this is definitely something that is a national crisis, but I definitely want to make sure, if need be, that we weigh in to support both Mount Sinai and its staff in the delivery of services to our community. So I have two hands raised. First, I'm going to go with Ascendi, who is our committee member who has a question. And then Anne, I do see your hand up, so just give me a moment. Ascendi, did you have a question or comment?
Yes, I did have a question. Considering that, you know, this is, we may be, excuse my hesitancy as I speak, but would it be possible to add an addendum to allow the nurse's personal experience to really shine through, as we also consider the language and structure that's needed to maintain the standards of CB11?
Is an excellent question. I know that story was shared here personally, and so we can double check. I don't know that meets the usual standard format of letter of support. So I'm going to pause on that for one moment, Osendi. And I'm going to double check in with Anne first and take her question, and then we'll circle right back or comment. Anne, the floor is yours.
Hi, good evening, everyone. I'm just noticing, and I don't know if I'm right to say this right now. I apologize, Ms. Nye. The second paragraph where it says 2,300 RNs, I was proposing if we could just change that whole sentence and just state that there are 3,261 registered nurses in 2021.
And can you confirm with us, Anne, where you're just getting that data from? Because there is no source listed.
3,261 RNs, and that is a seniority list that we received in November of 2021.
Okay, so I'm, Marlene, can I just call on you here for how we adjust the statement and how we also cite the source?
I'm sorry. Go ahead.
I said,
I'm listening.
Okay, I said, so she's making an adjustment to the numbers and she's also informing us of what the site is for the source of that information.
Right, so I got that source, this whole entire paragraph comes from the New York State Nurses Association website. So that's what I fill in when I fix this letter to eventually have the full board look at the draft. So, and if you can email me the source, I'll cite it correctly.
Thank you.
No problem.
Thank you.
So that would mean that we need to cross out the 150 and P's 80 because that's already not the current numbers.
Yeah, and if you could do me a favor and email to Marlene exactly what it says that needs to be deleted and what you would like to replace it with. So given this change, Marlene, are we still able to make a vote today?
If it pleases the committee, yes.
Okay. So I'm going to ask the committee members, if I don't see any other hands raised, so please forgive me, if we would like to vote on a letter of support. I'm going to first say that I'm going to have to recuse myself from the vote, so I will be voting present, not voting for this. But I believe that if it's up to the committee, if we would like to do a letter of support for this resolution. So I'm going to ask by just a raise of hands, if anyone would like to make a motion. So I see Robin, I'll call on Robin.
I move that we accept the letter with the revisions we've just discussed.
Okay, is there a second?
I second.
Who was that?
It was Robin, the other Robin.
Sorry, before you all go into a vote, Robin, I need the motion to be clearly stated. Are you making a motion that this committee?
I move that the committee accept the current letter with the revisions we just discussed tonight in support of NISNA. Is that clear enough?
Okay, I'm writing it. I'm sorry. Just give me a minute because
no problem.
Down for Nye and Art for the minutes. So I move that the committee accept the letter of support. That's what you said?
Yes, I am.
With the revisions that we just discussed on the floor, is what Robin said.
Support, is that what you said? In support of?
In support of NISNA.
Their resolution, because that's what the letter is for. I'm not putting words in your mouth, but I just want you to know that this letter is in support of their existing resolution. That's what the point of the letter is.
Yes, it's in support of their resolution. We state it right in the first paragraph.
Okay, sorry to interrupt you.
No problem.
Vote. I just need to be clear.
Sorry, I wasn't more specific.
No, it's fine. Thanks.
So there's a motion on the floor that needs a second. Is there any other member of the committee? If you are interested in seconding this motion, I need you to raise your hand. I see the other Robin Krinsky. I'm sorry, I know you were having technical difficulties. So I believe Robin had already verbally seconded, but Robin, I'm going to recall on you since we had to clarify the language.
I second the motion. I second it.
Thank you, Robin. Marlene, when you're ready, I'd like to do a roll call vote.
Eva Chan.
Yes.
Osendy Garcia,
Yes.
Robin Krinsky,
Yes.
Jennifer Meyer.
I'm present but not voting.
Thank you. Arturo Perez,
Yes.
Robin Stration,
Yes.
and Nye Whitaker.
I have a work conflict, so I'm present, not voting.
Okay, thanks. The motion carries.
So thank you so much for this presentation. I would like to invite the nurses who spoke today, as well as the members of NISNA, to the full board meeting at the end of this month. Marlene will follow up with you with that information. This would now move to the full board, and the full board would then get to vote on this. They may ask you in preparation for that to be prepared to present again. I do not know what the chair and the executive committee will determine regarding that, but I just wanted to put that out there as a possibility. I also want to take a moment to thank the nurses for sharing their personal stories. And I want to thank Brad, who on the fly responded with some very good detail that makes me very hopeful, that we will get past this crisis in the short and long term. And I invite Brad to follow up with us on the additional questions that we had. And I'm happy for Mount Sinai to also be present at the full board meeting in case questions come up, and to come back to us within 30 days. Marlene, are there any other items?
No, I just, when you're ready, I'll take the roll.
Great. So that concludes our agenda for the February meeting of the Health and Human Services Committee. We're now going to take a roll call vote before we close out.
This is just for attendance.
Yep.
May I go?
Yes, I'm sorry. I said vote. I meant roll call attendance. Excuse me. We are going to do roll call attendance in order to close out. So Marlene, the floor is yours.
Okay. Eva Chan.
Present.
Osendy Garcia.
Present.
Robin Krinsky.
Present.
Patricia Martin. Jennifer Meyer.
Present.
Shirley Pena. Arturo Perez.
Present.
Pastor Isaac Scott. Robin Stration.
Here, I'm present.
And Nye Whitaker.
Yes.
Present. Oh, someone said yes.
Oh, I'm sorry, who was that?
Was Isaac.
Isaac.
Okay, great. Thank you.
Yes.
So, yeah, we got you, Isaac.
Okay, thank you.
Great. So I am actually going to do a entertain, I guess, a motion to adjourn this meeting. I'd love to do it just by a larger verbal consent. So if there's anyone who is objecting to us adjourning, please raise your hand. Going once, going twice, 3 times. Okay. Thank you all so much for your patience. I know this was a lengthy meeting, but we had some stuff to take care of. And I, appreciate each and every one of our committee members, our presenters, and the general public. We will see you again in a month's time, if not before. And I just ask that everyone, please, please, please stay safe, wear your mask, wash your hands, get tested, stay healthy, get vaxxed, get boosted. Have a great night, everyone. Thank you.
Good night.
Good night.